Good morning, everybody. Welcome to another episode of Tooth Teacher Tuesday. I'm your host, Dr. Stephen Zahm, and for today's topic, kind of want to pick up where we left off a couple weeks ago. Um, we previously talked about the difference between the two types of buildup we get on our teeth, plaque versus calculus. Um, we talked about how calculus really can only come off your teeth at your dental cleanings. Today I want to kind of talk about the implications of not getting that calculus off your teeth, which would be periodontal disease. To briefly explain it, periodontal disease is when the gums and bone that surround your teeth that help hold them securely in place, when those bone and gums become unhealthy, typically due to having that calculus buildup there, resting on your gums. It creates this inflammation that starts out as gingivitis, where just the gums are inflamed, but over time, chronic presence of that calculus can lead to loss of the bone as well. That bone becomes inflamed and starts to break down, and that's what we call periodontitis. So essentially, the longer that calculus is present, the more bone loss a person will experience. And that's how eventually over time some people will start having teeth become loose and fall out, is because they've lost so much of that bony support that there's nothing to hold the teeth in. And that's unfortunately oftentimes where in a case that's advanced enough, they end up losing all their teeth and doing some kind of denture with or without implants as well. So to give you kind of an idea of what that would look like, here's an image of a person with some periodontitis. You'll notice in that image that, the gums aren't healthy. They're not up around the teeth. There's quite a bit of both gum and bone loss, that a lot of the root of the tooth is exposed, and that the teeth were kind of facing all different directions. And that's because without that bony support there, the teeth are mobile and free to move whatever direction they want. And that's kind of visually what it would look like. Here's an example of what periodontitis would look like on an x-ray. And I want you to pay close attention to just how much bone loss there is around these teeth. And so I hope you can appreciate that there's not a whole lot of bone that's holding the teeth in that patient's mouth. And that's due to that chronic presence of calculus eating away at the bone. And so, as I mentioned, in cases that are advanced enough, unfortunately, that's when we start losing teeth. But the good thing is if we catch periodontal disease early, it is very much treatable. Different ways of treating that. The most basic way would be what we call a scaling and root planing. The more common term for that would be a deep cleaning, where just like you get your regular cleaning at the dentist, a deep cleaning, as the name suggests, we just have to go deep below the gums, get down there and get all of that deeply seated buildup off the teeth. Typically it's in there so deep that we have to even get you numbed up just to do the cleaning. But it's very much, again, if we catch it early, a very much recoverable process, that we get that buildup off of there and keep patients coming back for their regular cleanings. We typically don't see any more bone loss, and we're able to save those teeth. So I hope that gives you a greater appreciation of why your cleanings are so important. After seeing those couple of cases of periodontitis, please remember to thank your hygienist for all they do to help keep your teeth from getting to that point. And then, give yourself a pat on the back as well, because, hopefully you're doing your part at home as well. But that's all for today's episode. Thank you for tuning in, and I look forward to seeing you next Tuesday on Tooth Teacher Tuesday. Have a great day, everybody.